Hi folks, Jonathan Zor here with the Virginia Center for Inclusive Communities. At VCIC, we are committed to supporting an equitable and inclusive response to the COVID-19 pandemic, and we're so fortunate to be connected with leaders across the Commonwealth of Virginia who share in that commitment. Since 1963, VCIC has recognized individuals and organizations with the Humanitarian Award, our highest honor for those who advance understanding and respect in Virginia. Through our new Humanitarian Spotlight series, I'm interviewing past Humanitarian Award recipients who are demonstrating important leadership in response to COVID-19. Today, I'm honored to be joined by Dr. Danny Avula, a 2019 VCIC Humanitarian Award recipient from the Richmond Chapter. Dr. Avula is director of the Richmond City and Henrico County Health Departments. He's a public health physician specializing in pediatrics and preventative medicine. He serves on a number of community boards, including Communities and Schools of Richmond and the Richmond Memorial Health Foundation. Dr. Avula, I know your time is precious. Thanks so much for taking a few minutes to chat with me today.
Yeah, so glad to be here, Jonathan.
You know, there's a lot in the news about how different groups are experiencing this pandemic differently, maybe based on race or class. In fact, I saw a headline recently that the majority of cases in the Richmond area of those who had died as a result of COVID-19 were Black or African American. What are you seeing and what are some of the outcomes based on identity?
Yeah, I think we're seeing that disparity play out in lots of different layers. Certainly the death numbers look that way. As of this week, we have in the city, 16 out of 18 of our deaths are to African Americans. In the county, about 48% of the 114 or so deaths in the county are in the African American population, and both of those numbers significantly outpace the baseline rates of the Black community in the city and the county. So there's no doubt that that our minority communities are feeling the brunt of this disease in different ways, and I would say that is, that's not something that COVID-19 has created, right? It is simply that COVID-19 is unearthing or illuminating the underlying drivers of poor health that we know exist. And from the beginning of this pandemic, we've known that people with underlying chronic disease, whether that's chronic lung disease or hypertension or diabetes, are going to have worse outcomes, and that has proven to be the case. I think the other thing that is real about the way that COVID-19 is affecting different communities is that our lower income and predominantly minority residents are in situations where they're at higher risk to actually contract the disease, whether that's because they are reliant on public transportation and so are getting on buses and are in closed spaces and are more likely to contract it that way, or continue to have to work frontline service jobs. And the reality is that so many of the residents of our region who are in that frontline service industry are Black and Latinx, and they are going to work every day and at risk because of that. I found both in conversations with colleagues and friends, but also through the work we've done as a health department in doing the contact tracing and following up with every positive case and then tracking down individual contacts to those cases, that it is much easier for those with means to be able to effectively quarantine and isolate, right? They can easily work from home behind a computer or by phone. They've got a safe space where they can isolate for the next 14 days. But for our lower income residents, that has been incredibly challenging.
Yeah, a lot of what you're describing there, Dr. Avula, reflect, I know a little bit that I've learned about, a lot more about the social determinants of health. I wonder if you can speak to what that concept is and how much those factors actually impact someone's health quality.
Yeah, absolutely. I mean, I think the social determinants of health is a lens that we have been building in public health over the last 20 years or so. And it's really changed the way that we approach trying to improve health, because prior to the emergence of a social determinants understanding, we kind of equated health to access to healthcare. If you're healthy, you have access to hospitals and doctors. And what we've increasingly seen over time is that is important, and that is one part of the equation, but there are many, many drivers of health outcomes that aren't simply, do you have access to healthcare? For example, what is the level of income that your family has? What is the stability of housing that your family has? Access to quality education, a social connectedness to a community really has huge impacts on mental and behavioral health. And so there are all of these elements about the built environment and the social environment, the safety of your neighborhood, the environmental air quality, for example. All of those things do have inputs. In fact, it turns out that healthcare access or access to quality healthcare providers is only about 20% of the equation, and all of those other things make up the other 80%.
Wow, that's a pretty significant statistic there. For those who are watching this and who want to do the right thing, what advice do you have for folks, and what opportunities are there for people who want to make a difference right now?
Yeah, maybe I'll answer that in two ways. In the midst of this pandemic, we have definitely seen the disproportionate share of challenge that our low-income minority residents have seen. And that's played out in different ways. In our African American population, early on when we began doing community testing, there was a lot of skepticism and leeriness about the health department coming into communities of color and offering testing. And understandably, because our country has had a horrific history when it comes to the way that healthcare and government have treated Black Americans. There have just been so many examples of exploitation, of experimentation, of dehumanization of those communities that has really strained the relationship with healthcare and created a lot of justifiable distrust. So when we started offering community testing, some of the early social media threads that we saw were, hey, we're not guinea pigs. Don't come in and test us for a vaccine. Or don't come find COVID-19 in our community because we don't need somebody looking for another excuse to evict us, right? There are all of these layers that were grounded in history, but weren't necessarily our intent or the crux of the work that we're doing. And so I think we have continued to persist in that, and community testing has actually gone really well. Each event we do, we're testing somewhere between 150 and 200 individuals. And so I would say to members of those communities, we understand the skepticism and the distrust, but I hope that our presence and our relational connectedness to so many of these communities and quality information would help understand that knowing whether you have COVID-19 or not is good for you and your health, but it's also good for the folks in your household and the folks that you may come into contact with. And so it is really important that we identify where this disease is so that we can protect as many people as possible. I think increasingly we've seen that with our Latinx population as we've tried to call those contacts, and I think the word is getting out that when the health department calls you, it's likely that we want that you've been exposed to COVID-19 and that we're going to ask you to quarantine for a period of time so that we can see if you incubate disease or not. And for some people, being out of work or not being able to collect a paycheck for 14 days just isn't viable. And so we as a community are working on figuring out how do we make that more possible? How do we allow folks to do the right thing, stay home from work, but not be financially penalized for that? And so I think there's a policy approach to that looks at things like paid sick leave, and there are other ways that we need to orient supports to those populations. I think for the rest of our community, it's understand, when we're so eager to get back to some sense of normalcy and to open up restaurants and businesses and everything else, I absolutely understand the desire and drive to have the economy be moving again. But I would ask that we all think about things through the lens of folks who may not have as much of a voice into those decisions, and to recognize that this disease is having really different impacts on different parts of our community, and our behavior and our potential exposure actually impacts everybody. And so I think thinking beyond how is this impacting me and my family, but understanding the nuance of how it affects our entire community.
Absolutely. The issues are big and multifaceted, and we're so fortunate to have you in a position of leadership to help guide us through it. So thank you, Dr. Danny Avula, for your time and for your expertise. I hope you continue to stay well and safe out there.
Thank you, Jonathan. Appreciate it.